An important health alert before you gather for Thanksgiving dinner. There is a medication shortage just as flu and RSV cases rise. The CDC is reporting at least 4.4 million flu cases with 38,000 hospitalizations, 2,100 deaths, and 7 of those were children. RSV cases are also on the rise. Here's a look at COVID cases nationwide. More than 600 counties report having high or medium levels of COVID, shown here in orange and yellow. The green counties are reporting low levels. Joining me now to talk about some alternatives to stave off getting sick is Dr. Amesh Adalja, a senior scholar at Johns Hopkins Center for Health Security with a focus on infectious disease and pandemic preparedness. Doctor, thank you for joining us.
Sure, thanks for having me.
And I want to start off by asking what you are expecting from an infectious disease standpoint for this holiday season, not just Thanksgiving, but Hanukkah, Christmas, Kwanzaa, New Year's, all of it.
We know that when people socially interact, there's going to be respiratory virus transmission. And we have very high levels of transmission of influenza, RSV, and COVID-19 right now. So we expect that cases will continue to increase, that there will be transmission events at these events because you can't get the risk down to zero. Hopefully, when it comes to COVID-19, we won't see that translate into hospitalizations because so many people have been protected with vaccines. We've got antivirals like Paxlovid. Flu, we have vaccines, antivirals. RSV is a little bit more tricky because that tends to affect the very young and the very old, and there aren't very many countermeasures against RSV that actually work at this time. So I do think that this respiratory virus season is going to be something like we saw back in 2018, back in 2019, before this pandemic altered the transmission of all these other respiratory viruses.
Well, potentially complicating things. You mentioned some antiviral drugs. Also, we've got a shortage of amoxicillin, which is commonly given for bacterial infections. So is this too much sickness, or is it overprescribing, or maybe a mixture of both?
It's probably a combination of both. We know that many doctors inappropriately give antibiotics to people that have viral infections. And amoxicillin is one that can be overprescribed. 80% of antibiotic prescriptions in the outpatient arena are inappropriate. So there is a lot of demand. There's a lot of respiratory viruses. We know that doctors will prescribe antibiotics inappropriately for respiratory viruses. So you've got that demand that wasn't anticipated by the manufacturers of amoxicillin, causing these shortages. The thing about amoxicillin is, yes, it's one of the easiest ones to give to children because it tastes good, but there are substitutes for amoxicillin in kids that actually need it, or individuals who actually need it, because these antibiotics are somewhat interchangeable when it comes to the amoxicillin. So I think that's not so much of a problem, but we do need to get a handle on inappropriate antimicrobial prescriptions because antibiotic resistance is a major public health threat that's underappreciated.
Yeah, the folks that have an amoxicillin allergy know all about the other alternative ideas for some antibiotics out there. Now, let me ask you this. We have been dealing with a pandemic and some respiratory illnesses since 2020. This is the third Thanksgiving to come around where we're being told, hey, be cautious around people, be cautious in group settings. I am curious if this year is any different, if we need to approach things any differently, or if the advice continues to be the same, to wash hands, to wear masks if you're around people that are especially at risk. What are we looking at here as far as advice goes? Is it any different than 2020 or 2021?
I think that the caution can be somewhat lessened because right now, when it comes to COVID, for example, we have a lot of immunity in the population from prior infection, from vaccinations, from boosters. We have wide availability of drugs like Paxlovid, which really has made COVID-19 not the same threat it was in Thanksgiving's past. So I do think that we can be much more liberal with how we approach these types of events. But remember, you can't get the risk down to zero. And for those people who are at high risk with conditions that increase their rate of hospitalization and death, they still have to be careful this Thanksgiving, next Thanksgiving, the Thanksgiving after that. So those individuals may want to think about who's coming, use tests, masks for certain people, do things outdoors. But for the average person that's vaccinated, I don't think that Thanksgiving is an unbearable risk. And we've got to get used to risk calculation because this virus is never going to leave us. We're always going to have to make risk calculations around it, just like we do with other respiratory viruses.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.